Artificial ventilation, also called artificial respiration, is means of assisting or stimulating respiration, a metabolic process referring to the overall exchange of gases in the body by pulmonary ventilation, external respiration, and internal respiration. It may take the form of manually providing air for a person who is not breathing or is not making sufficient respiratory effort, or it may be mechanical ventilation involving the use of a mechanical ventilator to move air in and out of the lungs when an individual is unable to breathe on their own, for example during surgery with general anesthesia or when an individual is in a coma or trauma. So the types of artificial ventilation, there are two main types, manual and mechanical. Manual pulmonary ventilation and hence external parts of respiration is achieved through manual insufflation of the lungs, either by the rescuer blowing into the patient's lung, mouth-to-mouth resuscitation, or by using a mechanical device to do so. Mechanical ventilation is a method to mechanically assist or replace spontaneous breathing. This may involve a machine called a ventilator, or the breathing may be assisted by a registered nurse, physician assistant, respiratory therapist, paramedic, or other suitable person compressing a bag valve mask or a set of bellows. Manual ventilation, i.e. mouth-to-mouth resuscitation. Mouth-to-mouth resuscitation, a form of artificial ventilation, is the act of assisting or stimulating respiration in which a rescuer presses their mouth against that of the victim and blows air into the person's lungs. Artificial respiration takes many forms but generally entails providing air for a person who is not breathing or is not making sufficient respiratory effort on their own. It is used on a patient with a beating heart or as part of cardiopulmonary resuscitation (CPR) to achieve the internal respiration. Insufflation, also known as rescue breaths or ventilation, is the act of mechanically forcing air into a patient's respiratory system. This can be achieved via a number of methods which will depend on the situation and equipment available. All methods require good airway management to perform, which ensures that the method is effective. Mechanical ventilation. Mechanical ventilation is indicated when the patient's spontaneous breathing is inadequate to maintain life. It is also indicated as prophylaxis for imminent collapse of other physiological functions or ineffective gas exchange in the lungs. Common specific medical indications for use include acute lung injury, including acute respiratory distress syndrome, and trauma. Apnea with respiratory arrest, including cases from intoxication. Acute severe asthma requiring intubation. Acute or chronic respiratory acidosis, most commonly with chronic obstructive pulmonary disease. And obesity hypoventilation syndrome. Acute respiratory acidosis. Hypoxemia with arterial partial pressure of oxygen hypotension include sepsis, shock, congestive heart failure. Neurological diseases such as muscular dystrophy and amyotrophic lateral sclerosis. Here I've included some pictures of what mechanical ventilation looks like. I hope that this presentation was helpful. Thank you very much.